Welcome back to Sensible 2020. I am your event host, Seth Adler. It is my privilege and honor to be in that role. So thanks for participating in this session. Thank you to all of our speakers and all of our attendees for all of the sessions that we've had to date. This session is supporting people who use drugs through COVID-19. Obviously, this is topical, and your moderator is Rachel Wissner. Without further ado, Rachel Wissner. Rachel?
Hi, thanks, Seth. Hello, everyone. My name is Rachel Wissner. My pronouns are she or they. I am the Development Associate at Students for Sensible Drug Policy. Today, we're going to be talking about how to support people who use drugs through COVID-19 crisis. We're going to be talking more about people who use more highly stigmatized drugs, the unique challenges that they face during this crisis. We're going to hear from someone with lived experience through this, as well as people doing the direct service work on the ground, and policy changes that local and state and federal governments can enact to support people through this crisis. So we have here Julia Hilbert, who's Secretary of SSDP's Board of Directors and staff member at Prevention Point Pittsburgh. So thanks, Julia. We also have Humphries, who is the Program Director at Harm Reduction Action Center in Denver, Colorado. And we have Devin Reaves here, who's the Executive Director of Pennsylvania Harm Reduction Coalition. So thanks, everybody, for being here, taking time to be on this panel. So thanks. Okay, so Julia, would you like to go first?
Sure. I think what we're starting to talk about in the beginning here is our old reality for people who use highly stigmatized drugs pre-COVID-19. So my work has mostly been with SSDP. I also run Pittsburgh Dance Safe, but with people who use highly stigmatized drugs, I obviously come by them most often in my work with Prevention Point, which is our syringe service program here in Pittsburgh. So we run a very great show with the syringe exchange here. We're in 5 different sites now as of recently around the city so that people don't have to travel as far to access services. And syringe exchange, unfortunately, is still illegal in Pennsylvania. And I'm sure Devin will talk about that more later. Prevention Point Pittsburgh and Prevention Point Philadelphia are our main syringe service programs, and a lot of others need to operate underground, which is not helpful for a variety of reasons. Yeah, I think that's as far as I'll go for now.
Thanks, Julia. Kat, you'd like to go next?
Sure. My name is Kat Humphries. As Rachel mentioned, I'm the Programs Director for the Harm Reduction Action Center in Denver, Colorado. We're Colorado's largest syringe access program. So my days in direct service prior to COVID-19, excuse me, looked quite a bit differently than it does today. So we do direct service Monday through Friday, 9 to noon, so 3 hours each morning. And then I would usually move into data, analysis, writing reports, writing grants, all of the above, all the fun back end side of being involved in a small nonprofit. I was also the primary tester for our agency, doing all the HIV, Hep C, and STI testing, which is a service that has since ceased in most capacities. So yeah, we basically are doing syringe access, where we also provide a host of other referrals for folks, you know, whatever they really kind of need, with a primary focus on serving people and doing direct service. That's the main part, the most important part of my job. Still doing it, but we'll get there later about kind of how things have changed. But for demographic reasons, you know, the population that we serve is about 75% of them are experiencing homelessness. So most of the folks that we serve are unhoused, and then about 25% own their own or rent their own rooms. So that's a big factor going into this entire pandemic as well. So I'll pass it over. I'll be brief, because really the main point here is what's changed, which is unfortunately a lot.
All right, and Devin, go ahead and introduce yourself.
Hey everybody, my name is Devin Reaves. My pronouns are he, him. I'm the executive director of the Pennsylvania Harm Reduction Coalition. Really what we do is we represent the 2 above ground syringe service programs in Pennsylvania and then the 16 underground syringe service programs across the state. Beyond doing kind of membership services for syringe service programs, we do a lot of advocacy work. We focus on 3 populations, trying to reduce overdose deaths. People that use drugs right now through expanding access to syringe service programs and leveling up current syringe service programs. Number 2, getting overdose prevention education in treatment centers. So we want everyone that's leaving a treatment center to get information about harm reduction, about how to use drugs safer, and a dose of naloxone for them and a loved one, and focusing on reducing overdose deaths for those coming out of the prison system. So a dose of naloxone and expanding access to opioid agonist therapies during when people are incarcerated.
Thanks, Devin. So could anyone speak to what things kind of look like on the ground before for people who use really more highly stigmatized drugs, and how COVID-19 has like so drastically changed things?
I can definitely speak to that, at least a little bit, and I'm sure everybody kind of can, but as somebody who's, providing services daily, everything has kind of changed as far as what services are available. It's really unclear and difficult, even as somebody with internet access and a smartphone, to figure out where is still providing food across Denver. It's really difficult to figure out how to apply for Medicaid over the phone when there's no phone available to you. There are about 100 different services that have been lost that we previously had access to make people's lives easier. We're still doing the best that we can, but I think as harm reductionists, we're really kind of, being put to the test in a way that, a lot of younger folks, such as myself, haven't had to deal with at this point, right? People in harm reduction are really crafty and smart and just clever, I think would be a good way of describing it. And we're having to come up with those solutions ourselves now. There aren't just these things have been thought up for decades and decades that we're implementing, and it's good strategy and we know how to do it, right? We're having to figure out what looks best for our folks on the ground, and that's probably different in every single area, and every local government is implementing different plans, and it's affecting everybody differently. And I can speak to that more a little bit maybe in depth later, but I just think that some of the plans are helpful and some of them aren't. In Denver, they're implementing a mega shelter. They've closed all the shelters downtown and put together 600 beds 8 miles north of the city for people, well, for male identifying people for now, which is great, right? Because there's no, homeless women or children in Denver. So it's just seeing things like that happening and talking to people about how the virus spreads, and then them having a really good understanding of it eventually, because it's all they've heard and it's the reason why everything that they have access to normally is shut down. And then telling them the best option that they have is to go to a 600-bed shelter where the beds are 5 feet apart each. And I just was having a conversation with somebody. Oh, and for context, it's also 19 degrees outside and blizzarding right now. So I was talking to somebody this morning about what are you going to do? Because the weather is going to be bad all week. And if you're in really bad shape after this weekend, we got to make a plan for you. And he said, well, I don't want to go to that shelter. I understand how this spreads. That seems like a really bad idea. And there's nothing I can say to the contrary, because that's true. There aren't better options for people right now. And it's really heartbreaking, because also all of the very essential services, like access to food, while there is still some access to food across the city, it's very difficult to navigate. So just basic essentials, we're having to pivot our services where we cut down almost everything that we do except for syringe exchange and Narcan, to also providing every essential basic needs that we can, right? Every snack, every hand warmer, socks, hats, gloves, hygiene kits, everything that you can think of that people were getting elsewhere. They don't have it anymore. And I can't tell you, since this crisis has started, how many people have said, this stuff saved my life this weekend. And people say that kind of stuff to us a lot, right? We get a lot of appreciation, a lot of thanks for what we do, truly. But I've never seen it as sincere as through this pandemic. So people are in a really bad spot, need a lot.
Well, thanks, Kat. Guess Julia or Devin, would you like to speak about local challenges in Pennsylvania then?
I'll go first, and I'm sure Devin can follow with some more macro stuff that's going on in Pennsylvania right now, but just speaking from working at Prevention Point Pittsburgh. As Kat said, same thing for service programs. I mean, we're not testing folks for HIV and Hep C anymore. We're providing very limited wound care service to folks because frankly, our nurses who volunteer for us are just needed in a million places right now. We have no volunteers right now. We're running entirely on staff, and the staff has been split up into 2 teams. So I haven't seen our executive director or some of my coworkers in person in like over a month now. That complicates things too for services who have smaller staff, like syringe service programs do, that are still running. And I think, something that's hard, especially for people that to be experiencing homelessness, and as Kat spoke to, is that we have participants that are regular that would come every single week to the same site that we haven't seen. That's something that's difficult to deal with in and of itself. You're worried about your folks. And I think people who use drugs and sex workers, I'm going to say, are always the most left behind, right? And they're super left behind right now. Like no one has given, much in terms of policy, in terms of what the local government has done. I can speak to the food thing as well. We usually have a food pantry available, in our Sunday site in person. It's right in conjunction with our syringe exchange site. So people that were relying on that every week, they just shut it one week and did not give any warning. We're trying our best to understand what's still open and like what's still available and being able to refer people to that. But we had, this huge list of resources that were available to people, and now we don't know where to send them. And like, we don't know what to tell them the right answer is. And I think with the other portion of those people being forgotten is also that the people that provide their care are often forgotten by local government and people who are not other people that provide that sort of direct service. I think we've seen a lot of appreciation for our healthcare workers and stuff that is, of course, warranted. I haven't really heard that same kind of love for social workers and for public health people and people who work in syringe service and other food, homeless shelters, essential services that way, that people are also putting themselves at risk to go out there and take care of their folks. And I'm sure they would rather not be doing anything else. But the hazard pay and a lot of the benefits that were given, a lot of the money and resources that was given, obviously to the medical field is not always afforded to us that way. So yeah, I think we also have a lot of operations on hold. Prevention Point Pittsburgh was about to hire 7 new part-time people. The only reason my hiring went through is because I was there before and after. I stayed doing my shifts the whole time, but all of that is on pause, trying to figure out our opioid replacement therapy or anything. Our UP on a van with our mobile outreach has been paused, obviously. So it's cutting into our services very immensely for the people that need them, our everyday activities, as well as other things that we would refer them to. So it can put providers in a rough spot. And also people are concerned about their supply in general, which I feel like is important to bring up. If your dealer gets sick, where do you find it then? If things aren't going well with the supply, how do you address that when everything is all mixed up for how it normally is? So that's hard. A lot of these people don't have incomes that they're included in the stimulus bill either. And I think it's important to note that legal sex workers were taken completely out of the stimulus bill. So yeah, a lot of financial challenges there as well. And I'll turn it over to Devin for some more outside of Pittsburgh, Pennsylvania stuff.
Sure. Thanks, Julia. You know, I really can't minimize Julia's comment about how we're putting doctors and nurses on this pedestal, but harm reduction workers, homeless outreach workers are just being forgotten, not just on like Facebook memes, but also access to PPE and access to other things that they need to keep themselves safe. You know, we are hearing about syringe service programs across the country where outbreaks happened, where they had to close down, and that's just wrong, right? In the state of New Jersey, more than half of the syringe service programs closed, and it was because of lack of, you know, personal protection equipment. And, you know, we always knew that our people who use drugs, especially, you know, stigmatized substances, not college kids getting high, they got lots of resources, they have lots of access. Many of them are back at home living with mommy and daddy, but people who are experiencing homelessness, people who are chaotic drug users are just being kind of cannibalized in a lot of ways. Some of the cool things that we are doing in Pennsylvania is we've teamed up with Next Distro and Prevention Point Pittsburgh to do a mail-based naloxone distribution program. We're also doing shipping. We got 6,000 doses of naloxone the other day, and we're also shipping naloxone to prisons because we know that decarceration is something that's really moving forward quickly during COVID-19. The other thing we're trying to do is get naloxone to organizations that serve people who use drugs. So we've sent it to street medicine teams, homeless outreach organizations, things like that, because the average way somebody would get naloxone is just not open anymore. I think the other really scary thing is that the drug supply is really all over the place. You know, for example, in Philly, there's this head shop, Wonderland, and that's a lot of people who sell drugs go there to buy vitamin C to cut their drugs with. However, Wonderland's closed. So I don't know what people who, you know, frequent that establishment often are using to cut their drugs with now. And that's really dangerous. And we're actually seeing a resurgence of heroin in Philadelphia. I haven't seen heroin in Philadelphia in many years. And I think a lot of people that had a problem with chaotic drug use in the past that are kind of what they would call recovery now are also struggling and just having reoccurrences of use that maybe isn't part of their personal goal. And I think that is a struggle, and it's something that we should be talking about. I think overall what we want to see is people getting out of jail. We want to see new people not getting into jail. We want to see people experiencing homelessness, part of a comprehensive plan, not what they're doing in Las Vegas, putting them in the sidewalk in a city with more hotels than any place else in the world. And definitely not what's happening in Denver. You know, we want to keep people close to where they use drugs at and we don't want to put too high of a threshold to stay into those programs. So we want to be able to let people leave, purchase their drugs, come back. And really what it comes down to is we didn't have the public health infrastructure or the harm reduction infrastructure or the advocacy efforts to really make sure that our people weren't kind of destroyed by this. So, you know, now what I want you to think about is 20 years from now, you know, how do you want to say you were part of the change post-COVID? That's really what it's about. We have to advocate because all this shit's happening because we're letting people in power do it.
Yeah, very true. Thank you for those words, Devin. I think now I want to turn it over to our anonymous panelists who will be speaking about their direct experiences through this crisis. Thank you so much for being here to speak for that. We really, really appreciate it.
Hi, thank you. Like a lot of people have already covered, the high stress of COVID-19 and all of the conditions surrounding it, like not knowing where our income is coming from, being concerned about getting food and losing homes, and worrying about the health of our loved ones, that creates conditions where it's a lot harder to control drug use. I know personally, I've experienced a lot less control than I had before this happened. And also it's creating conditions where people often have to use alone. and that creates a higher risk of overdoses and other drug-related emergencies. I know that my friends and I who use drugs have been getting kind of creative with that, as far as like being on a phone call or a video chat with someone while they're using and knowing where they are, so that if something were to happen, we could send emergency services there. But there are certain things that we would be able to do in person that we can't do over video. Like, we can't administer Narcan, for example, while we wait for the ambulance to get there. And with drug users being such low priority normally in the healthcare system, and having less access to healthcare, I really worry about, with the healthcare system being overloaded, overdoses and other drug-related emergencies being deprioritized even more than they are now. There's also, other than drug-related emergencies, there are certain health problems that people who use drugs are likely to experience, like decreased immunity if they were to get sick, especially if you don't have somewhere to shelter in place. And just the logistics of obtaining and using drugs. Because of the criminalization of drugs, we don't have the regulation to make sure there are procedures for disinfecting drugs. We don't realistically know who has handled those drugs or how they have handled it. And we have to go somewhere and have in-person contact in order to obtain those drugs, usually regularly. And if you're going to like a drug dealer's house, there's people in and out all the time. It's like a setting where it's especially dangerous to be. Also, I know where I currently am, there is a shelter in place order, and there's actually a police enforced curfew in my city. And while arrests seem to have gone down right now, there is a more visible police presence. And I know some people who are considered essential workers are actually getting papers to present to police if they to give them a reason why they're out, which is really scary if you're out to obtain drugs, and especially if you're part of a population that is more likely to experience police brutality otherwise.
Thank you for that. Now I want to move into solutions, like policy solutions that we could be doing to better support people, and policy solutions that like directly address the crisis, but maybe perhaps we can touch on like a little bit of like what ideal policies look like for people who use drugs, right? Because if those already existed in place, like people would be much better protected against COVID-19. So, and I guess, Devin, you can go ahead and speak to that, and then we can also open it up to everybody else too.
Sure. I think, one of the things that the federal government did, what we're seeing is a lot of bad policies that were driven by a moralistic response to drug use just being thrown out of the window because they just didn't have a leg to stand on anymore. I think the greatest example is the 14 and 28-day take home for methadone, no longer needing to have an in-person visit for a prescription of Suboxone. Those are the two biggest things, because we know the drug supply is going to diminish, dwindle, and maybe disappear. And so we want people to have access to medications for opioid use disorder, because detox sucks, right? And I think we also need to, from a policy perspective, include people who use drugs. I was talking to somebody from a local city in Pittsburgh, and they were like, we're going to put out a thing about use your own pipe. And I was like, well, have you ever smoked crack before? And they were like, well, no. I said, well, let me tell you, like the crack pipe or a smoking pipe is a lot like a cast iron pan, right? Like it gets like all that good juices on it, and like you don't want to like miss that, right? The first hit is not as good as the second hit. Let's not say don't share your pipe. Let's say use what I would call like a pipe koozie, right? You see those sometimes. Like that is good advice. People who use drugs will be like, all right, that makes sense. And all the time we should incorporate people who use drugs into policy development, right? That's a no-brainer. Another big thing we want to see is, there's this push, like a lot of people are criminal justice kind of advocates now, like Kim Kardashian and Meek Mill, but a lot of them have a very narrow understanding of what effective drug policy looks like. And we're seeing people just being pushed out of the door in criminal justice settings, and they're not being connected with treatment resources, they're not being connected with housing. And that's a problem. We need to be engaging them with social services while getting them out of the door as quickly as possible. You know, most county correctional facilities do not offer medications for opioid use disorder, even though they should. And we should have everybody stepping out of their correctional time with a 30-day script or a 30-day supply of medications for opioid use disorder and an appointment for therapy or telehealth, because we know that people that are getting out of corrections experience overdose at 40 to 120 times that of the general public. There's research about that. I mean, you know, we know that our people are forgotten, and I think we're going to see a spike in overdose deaths because we're not giving people the help they need. And the last policy perspective thing that I really want to see that's, you know, kind of been nibbling around the edges in America is safe supply. You know, we're seeing in Canada, this has pushed safe supply through the roof in a lot of cities. We should be talking about that in America, whether it's Dilaudid, Oxy, you know, replacements for methamphetamines. It's just a no-brainer, right? And my biggest hope post-COVID is that we will advocate for and get a real public health infrastructure. I live in a state where only 9 out of the 67 counties have public health departments. And so we weren't able to respond to the overdose epidemic, let alone 2 nationally and state declared public health emergencies.
Thanks, Devin. If anybody else wants to add to that, please go ahead. And then I think we'll wrap it up after that.
I just have a very quick point, because I think those are all much bigger, you know, macro policy level concerns that, you know, we need to take care of in Pennsylvania for sure. I mentioned this before, but syringe exchange is illegal here. I can't wait to confront the hypocrisy of that when the time comes at our capital to say we were a life-sustaining medical service that is illegal. Ridiculous. So I really hope that that helps us move forward on being one of the only states in this area of the country that does not have the privilege to operate normally. And also alcohol. I just wanted to throw that out there real quick. Pennsylvania has some very, very strange liquor laws that's resulted in absolutely no liquor sales happening since COVID has started. And we had to fight for our beer distributors to be back opened, right? Like, they weren't even open before, and someone had to explain to the Secretary of Health that people who are dependent on alcohol, people with alcohol use disorder, are in danger of going into withdrawal now. And although all kinds of withdrawal are painful and should be experienced in the most comfortable way possible, alcohol use withdrawal can kill people. They can have a seizure. They are alone, most likely, with the shelter-in-place orders. And I've had some friends that we've been dealing with this with. West Virginia has closed their borders to us, you know, and so have some other states, understandably. But yeah, we can't get liquor at all. And that's a problem for people who use drugs in Pennsylvania.
And we're the only state with a stay-at-home order that closed the liquor stores.
That's correct. Thank you, Devin.
I just wanted to say I appreciate what Devin had to say earlier about us crafting better policy and that it is on us. And I think that something to kind of reiterate that is that moving forward, that this has to be a priority. You know, and I don't think people who are living on the streets, unhoused folks, are a priority at all. Shelter in place, I think that, like, shelter where? We've closed down our major parks. We've pushed people out to the outskirts of the cities. We have to have a better plan. And we have so many countless hotels that are sitting empty right now. I think, you know, policy solutions wise, a lot of stuff has been mentioned, but things that people can do is, you know, call your local government, call your mayor, call your governor, call whoever in your state is in charge of making some decisions about this, and let them know that, like, literally anybody cares, because right now it's just not a priority for them. And also reach out to your local syringe exchange, your local, you know, treatment programs that are still operating, whoever, like, you care about most, whatever. But, like, ask them how you can be supportive. Donate money. I'll tell you, that's the first and best way you can be supportive right now. Donate socks, donate food, donate the things that they need the most. Because I think one of the biggest things that I glossed over that Julia really hit on was that we don't have volunteers anymore. We don't have interns. We're down about 8 people a day to a like 6-person staff. So we really run on volunteers. And also just like also managing everybody's requests about how can I be helpful is a full-time job too. So like give people your money. If you got it, give it. You know, perhaps a few people might be getting, you know, some money in the mail in the next couple weeks. I don't know, but check it out. Find who's local to you and please donate to them. That's the #1 way that you support people right now.
Great. Well, thank you so much, everybody, for joining us on this virtual panel. This was very enlightening, very informative. You know, thank you so much for taking the time out of your busy schedules, as I know, like, you know, your direct service providers, like, you guys are really, you know, working so hard out there. And I just want to express my own gratitude for y'all for doing the hard work that is like totally thankless from our government, from just the general public, because people are focused on, you know, doctors and nurses and stuff. So like, thank you from the bottom of my heart for serving really vulnerable people, and keep doing the really incredible work you're doing. Thanks again for being here.